When children need an ankle-foot orthosis, which is another name for a splint, the purpose of it is to keep the range of movement free at the ankle. Children at this stage tend to walk a little bit up on their toes sometimes, and we want them to be able to pull their foot up towards them and have that range of movement free. To make them, we take a cast, and they're made for each individual's measurement. The cast is an easy process which isn't painful at all. And from the cast we then make the splint, which is going to go from the end of the toes to behind the knee, and it looks a little bit just like a big boot without a front on. It can be made of different materials. Some people like to make it out of a plastic material with a lining on the inside, and that keeps a very neat splint. The splint should be normally worn for between 6 or 7 hours per day, and by doing that the ankle movement will be kept so that the foot will go to 90 degrees or flat when you're standing. A time in the children's life comes along when they start falling frequently, and further to that the time comes when it really starts getting difficult to go from one side of a room to another with ease. At that stage, some regimes suggest the supplying of a knee-ankle-foot orthosis, or a CAFO. This is a type of splint which extends from the toes going right to the top of the leg, and the height you virtually sit on the top. The purpose of the CAFOs is to keep the child able to walk for as long as possible. The prerequisites are what you need to be able to wear these. Firstly, your feet need to be flat or at 90 degrees to your leg. If they're not, it really gets quite difficult to be able to fit the knee-ankle-foot orthosis, and sometimes minor surgery has to take place. In addition to the feet being flat, it's useful if the knees are straight and the hips are straight. So all that work that's done with physiotherapists earlier on is highly important, and be able to keep that movement there. The real key to success is the child being motivated to want to walk, and for that to occur, the parents have to be in huge support of the child. When that occurs, really walking can be very successful. Sometimes mum and dad need support as well, because it's unknown territory to them and their child's in a splint for the first time, and they are not certain of the things that need to be done. So if everyone supports everyone throughout the whole process, walking can be very successful. If it's seen as being a chore, it's a nuisance, then in fact it can fail. The knee-ankle-foot orthoses should be worn all the time, really, so that they're available to stand and to walk whenever somebody wants to do so. If it's put on for a special occasion, that again tends to be a nuisance to everyone, and so it doesn't tend to be done. If they're on and worn all the day, then success is more likely. Probably the biggest benefits of using the knee-ankle-foot orthosis is the fact that contractures are going to be kept to a minimum. And by standing, the hips are going to be stretched, the knees are going to be stretched, and the ankles are going to be stretched. This is a benefit right throughout the child's life.